It's well done. Honestly, that's going to be the hardest part when I'm pregnant is eating my steak well done. I probably just won't eat it. All right, now you never want to take any supplements over the counter without talking to your doctor first. Same with any type of drugs, vitamins, herbs, anything like that. You want to avoid alcohol, of course. Any raw fish, sushi. I'm sorry, kitty. Raw oysters. Anything with high doses of vitamins A, D, E, and K. Any herbs, caffeine. You don't want to have caffeine while you're pregnant. Tannic acid, which is found in non-herbal teas. And then raw or undercooked meat or eggs. So I've already kind of talked about that. Now, what risk factors do you have nutritionally? So if you have anemia, it means that you are low in iron and it can cause fatigue. So a lot of times if you have anemia, they might have you on an iron supplement, and they'll be watching you carefully. So this is something like your doctor should know that you have, and so they should have related it to you that you have it as well. So if you don't have it, you're okay. Any eating disorders, of course it says up there mental disorders requiring medical treatment, so anorexia nervosa, bulimia. You could also have a combination. If you're not having any issues with that, you don't really have to worry about it. Obesity. So this is the largest disorder in the U.S., 20% more or more than the ideal weight. So we kind of talked about BMI in Monday's class where we were talking about healthy weight gain. So this is kind of where it comes in. Any dietary fads? Pica. Has anybody heard of pica? Yes. It's when you're thank you for raising your hand. It's when you're eating foods such as clay, starch, dirt. So you might see other women doing this as well. And if you're pregnant and you're doing this, it's especially important for you to call your doctor right away, because if you're having a craving for cornstarch, we've heard of cigarette butts, like some really stuff that you don't want to be eating, you want to call your doctor because it means that you have a deficiency somewhere, and so they need to give you some type of supplement, or they need to at least talk to you about how to cope with it without having to indulge. This includes ice. If you chew on ice, you have like a happening. I see you looking at me. If you have a habit of chewing on ice, that could be a sign that you're low in iron. So talk to your doctor. Make sure you tell your doctor that you've been having this urge to chew on ice. So craving for ice related to low iron. That's the most common one. If you have any cultural and financial status, so if you're of low income and you're having trouble getting to food, that can cause some problems. Also, young age and substance use. This is all improper food take. So, young people like to eat junk food. I'm a young person, I do it. But you want to try to eat as healthy as possible. And then cultural beliefs. So if your culture believes that you should eat certain foods or you should avoid certain foods, this might cause a problem as well. Vegetarians, a lot of vegetarians, they have to find their protein in other ways. So beans, nuts. I was going to say, I can't think of another one off the top of my head. And then underweight. If you're underweight, you're not taking enough calories in, then that could be a sign of why you're underweight, and it could cause some nutritional issues. So now we kind of already talked about WIC. So you have to qualify for WIC, so it's not something that's just free and everybody gets. WIC stands for Women's, Infants, and Children. It's based on 185% of the federal poverty level and family size. The guidelines for WIC often change, so you can always call and check and see what their guidelines are. So this is talking about the benefits here. So they give you assistance while you're pregnant to help purchase different foods for your household, really for yourself. So like milk, the whole grains, fruits, cereal, things like that. They also offer different services for pregnant women, which is they check your body weight, they counsel you for nutrition. If you have diabetes, they counsel you for that as well. Also weight gain, anemia, and pica, but they also offer you breastfeeding support. They have lactation consultants on staff that can help you. Now, the lactation consultants they have are usually by phone, or you have to go into the office. So just keep that in mind as well. If you do have them, they're not going to come out to your house. You're going to call them and they're going to give you support over the phone, or they're going to say, hey, come see me at the office. They also do services for postpartum women, so counseling for weight loss, good nutrition. It talks about the breastfeeding. It says breastfeeding supplies if available. What that means is that if you have a return to work or school date within 2 weeks, they will let you borrow a pump from them, and you can use the pump to pump milk to build up your storage. And I don't know what the guidelines are after that for how long you get to keep the pump until, I don't know if it's until you're done breastfeeding or something changes in your income, or if you're not working anymore. So that would be something you'd have to check with them, but it is a service they offer. And then services for baby's first year, assistance purchasing formula and infant food. So if you're not planning on breastfeeding, this is going to be a good service for you because they're going to give you formula. Now, with that being said, it's a supplemental program, so that formula they give you is not going to be enough for the baby. You're still going to have to buy formula yourself. Now, Healthy Start. Has anybody heard of Healthy Start? Since you're sitting in our building, I'm hoping the answer is yes. So, Healthy Start, we're a service, free and voluntary for everybody. I'm not going to go into too much detail because I think everybody here is a part of the Healthy Start program. Yes. Now, with Healthy Start, we want to talk to you about a couple things. So, of course, we do the parenting education and support. Right now, while you're pregnant, we're probably doing Partners for Healthy Babies, going over preparing you for childbirth and helping you throughout your pregnancy. Now, once your baby's born, and I'm going to pass this around, this one here, we use a curriculum called Parents as Teachers. So this first page talks about Welcome to Parents as Teachers, and we're going to leave this out so you guys can review it during break as well. We have development charts. So basically what we're doing is after the baby's born, we're going to provide parenting support to you in the form of, we're going to make sure your baby's on track developmentally. We give you this development chart so you can track yourself at home. It's 4 domains, so there's 4 different sections here that you can track with the development. We'll always go over a topic with you, a parenting topic. So this one here just so happens to be about your baby's teeth. Each time we'd come and visit, we would tailor the program to you, so whatever parenting topic that you would need to go over. But this one specifically is about your baby's teeth. So we pull out the key points from this, we discuss it with you, we'd leave this with you, and if you had any questions, we'd answer them, whether they're at the visit or you could always call or text us. And then we always give you an activity to do with the baby. And I'm going to let Jennifer explain this activity because it just so happens to be her favorite.
It is. That's why I printed it. So it's called Balls in a Bowl. And basically we're dealing with a child who's usually about 6 to 8 months old. And what we're basically teaching them to do is be loud. So we sit them on the floor and we give them hopefully a metal bowl. And if I'm lucky, a wood spoon, and we teach the baby to actually bang on the bowl with the spoon. But the activity is actually teaching them to stir and move balls around inside the bowl, which to me is secondary. I want them to bang on the side, especially if it's a little boy, because, well, I'm like that. And I get to go home and the parents get to live with that one. But these are things to help your child with motor skills. Your child has to learn how to use their hands. So to help them learn that they can make noise is also cause and effect. So we're affecting several things at once to help your child grow and develop normally just with one activity.
And just with the parenting, so we're still talking about parenting here. We also, which I'm going to hand around, we do what we call ages and stages. And now this is a developmental tool your pediatrician might be using as well, but we do it as well. So this is, you want as many people to be checking on your child as possible, because if anything happens, which hopefully your baby's going to be healthy, happy, and nothing ever goes wrong. But having as many people in that child's life and checking that child is just going to mean that if there is something wrong, we catch it even sooner. So what this is that we go over, and I'm going to pass these around so you can look at the type of questions. So there's 3 different ages and stages we've included to kind of give you an idea of how over the baby's years, how it changes. But it asks a series of questions. So for example, under communication, does your baby sometimes make throaty or gurgling sounds? And then there's 3 answers. And so as we go through this and we help you fill it out for your child, you get a score. Now this isn't, we're trying to come in and you want the highest score, and we want you to be honest with us, because being honest with us is the only way we're going to be able to help your child. And then at the end we score your child, and then if we have any concerns, we're going to discuss it right there with you in the home. Hey, your baby scored a little bit low in this area, we're a little bit concerned, here's some activities you can do to help increase this area. Or if we're worried that something else might be going on, we might refer you to your pediatrician, or there's a program called Early Steps that also helps with development. So depending on that. Do you have anything else to say about that? Did I explain that well? Okay. So we're going to pass these around as well. Again, these are going to be available during the break as well for you to look at, so you can kind of really get an idea of what we do with the babies. One of the other services, of course, we do the breastfeeding education and support. So while WIC cannot come to you, we can. We can come to you in home. We can come to you at the hospital, as long as it's within our jurisdiction. So it could be in Lake County or the high-risk hospital. If you give birth at the high-risk hospital, we're also allowed to come down to the high-risk hospital, which would be Winnie Palmer. So if you need any breastfeeding support, we're there for you there with that. You might also be receiving that service now while you're pregnant. We do the childbirth education. Y'all are here. We also do tobacco, so if you have anybody that needs tobacco cessation in your family that wants to be involved with a child, we can offer that as well. Conceptual.
Just say women's issues. I just say women's issues.
Women's issues. Counseling. So that's going to be getting you ready for the next pregnancy, which hopefully should not be for 18 to 24 months.
Or 4 years.
That's good too.
That's great. However long you want to take. So if you need help with, you have questions about birth control, you have any women's health issues, so if you're wondering how to do a breast exam or, dental issues, this is what this would fall under. This is all about the woman. So this is more like a mother service that we offer, because we focus mostly on the mother with this one. And then car seat inspections. I've had a long day, I'm sorry. Car seat inspection. So as we said Monday, all three of us are car seat certified. We're car seat technicians, so if you need a car seat inspection before you go to the hospital, or if you get a car seat and you want us just to kind of look and make sure it's installed correctly, we can do that for you. Yes, we also give out car seats if you need one, only if you don't already have one. So if you've already bought an infant carrier, our car seats aren't infant carriers, so we suggest that you just go ahead and use your infant carrier until the baby meets the height and weight, height or weight, and then we can go ahead and get you a car seat for the higher weight. Any questions about Healthy Start? No? Oh. This one's yours.
This is mine. So we're going to start talking about breastfeeding now. Is everybody here at least considering breastfeeding, or how are we considering?
Yeah, we are.
Okay. You're going to breastfeed. Brianna, you and I have talked.
And Tandra, you're breastfeeding.
Of course.
Okay. So this is your section. What we're going to talk about here are the changes of the breast. At 1 month of pregnancy, I think we're all going to remember early in pregnancy our breasts were really sore. And the reason that is that our breast has a cell in it called an alveoli. And an alveoli is the cell that makes milk. Yeah, I know. So,
Are you laughing at Lactisa?
No.
Oh.
This one.
This is Lactisa.
Yes.
This is our breastfeeding baby.
yes. And this is our sister Lactisa, our breastfeeding. We did not name them, by the way. That is their name.
Yeah, that's their name that they come from.
Yes.
You got that one?
Yes, I have this one. Okay. So this is a breast model, obviously. They actually go together, which is why the baby's tongue is sticking out. It's so that they go together, because the babies do look funny with the tongue sticking out. But basically, this is a model of what your breast would look like if we could remove your skin. So these red cells, and these colors are a little exaggerated, are going to be the alveoli. And these are the cells that make milk. In early pregnancy is when they grow. And since there's no room for them, we have a lot of breast pain and tenderness as they come in, because there's no room for them. And so that kind of explains why you had a lot of breast pain. And for some women, breast tenderness and breast pain is how they know they're pregnant. So I don't know if anybody had that experience or not.
Is what?
That's how they know they're pregnant, because their
Oh,
breasts hurt a lot. At 5 months of pregnancy, all of our alveoli are there. They link to our ducts, and they're getting ready to make milk. At 9 months of pregnancy, they are actually complete. They can make milk at any time. And then, of course, lactating, we can see that All of the alveoli are there. You can see there's some changes in between 9 months and lactating, and of course the nipple does protrude a little bit more when you're lactating, but all of that does go back to normal. You can start to lactate at 5 months of gestational age, and for most women it's going to be a little bit of maybe flake or white stuff that they're finding inside their bra or on their nipples. This is in fact milk. You do not have dry skin. You don't have to do anything. It's normal. So what we want to talk about here are the benefits of breastfeeding. Why do you want to breastfeed? So let's talk about some benefits to the mom first. Can anybody think of a breastfeeding benefit to the mom?
Burns calories.
It does burn calories. It can burn up to 500 calories a day, which can definitely help get back to your pre-pregnant body size. Okay. Can anybody think of another reason to breastfeed?
Bonding.
Bonding is a very big one.
We still need answers.
There's more, we promise. Bonding is one of the most important things that we can do with our baby. If we cannot bond with our baby, it can cause a lot of issues for the baby later on. So what was your answer?
That was my answer, but I just got
I know, tell me the one you just got.
Well, I'm at a disadvantage here. It's easier.
It is easier. So we have our bottle, okay, and we have to get water in the right amount, and we have to get formula in the right amount, and we have to mix it up, and we have to warm it up, and we have to feed our baby, then we have to wash our bottle, and sterilize our bottle, and have all this stuff to keep these bottles cleaned and alike. Or we could just breastfeed, okay? Anybody have another idea for benefits to the mom?
Saves her money.
Very true, very true. It does save us money. It can save $1,500 a year according to our book. Okay. Any other benefits? No. What about breastfeeding exclusively for 6 months, which is the recommendation of the doctors, will lower your chance of breast and ovarian cancer later in life. Okay. It can also lower your chance of type 2 diabetes. That's a big reason to breastfeed right there. Okay. What about for the baby? Can anybody think of a benefit to our babies?
Nutrients.
Yes. It is the exact nutrient that your baby needs every day. Very, very true.
It's easier for them to digest
That
the
is-
formula.
That is very true. And it lowers our baby's chance of colic. Does anybody know what colic is? No. Yes, no?
Mhm.
Maybe no? Okay. Any other benefits to our babies?
Bonding.
It's already up
that's
there.
true. That's true.
It's already up
I
there.
cannot argue with this one. I cannot. It's a little cheating, but okay. What about our baby actually gets a copy of our immune system when we first breastfeed in those first few days. So all of the colds and flus and the like that we've had throughout our lives, our baby is just not going to get. That's a pretty good reason to breastfeed. Okay. It's also going to lower your child's chances of things like lower respiratory infections. Type 1 and type 2 diabetes can lower the baby's chances of SIDS. Potentially. That study is still ongoing, but I think it's probably going to show that it does lower the baby's chance of SIDS. So, it's a really good reason to. She wrote 2.
I want to write all that out again.
All right, we'll give that one to you. Okay, so what about benefits to society? If you breastfeed your baby, how are you benefiting everybody else?
You're giving people things to post about on Facebook.
Well, yes. And I take no responsibility on that one, I'm just saying, okay?
Think about the baby being less sick. What does that mean for mom if she's working?
This is true.
She's going to miss less work.
Yeah.
Because the baby's going to be sick less, which means mom doesn't have to take the time off. For that, at least.
So if you're breastfeeding and you're bonding more deeply with your baby, what do you think that does for your chance of abuse and neglect to your child? It's going to lower your chance, okay? You're going to lower medical costs, Medicaid costs, because your baby's not sick as often. That's the benefit to society.
Lowered waste. If you're breastfeeding, you're not putting as much of the bags that go into the bottles. You're also not having to wash as many or throw away as many bottles.
So, did anybody hear a benefit here that they didn't know before? And
I haven't heard of the lowering chances of ovarian cancer. I haven't heard of that.
That comes from our breastfeeding book, which hopefully your care coordinator's giving you a copy of. If not, we'll get you one today. And of course, this is just a list that we came up with in 5 minutes. This is not an inclusive list, and actually we're learning more and more things about breastfeeding every day, okay? But let's talk about the information that they give us to pass on to you, what they say the benefits are. So the benefits to the mom, it is gonna lower your postpartum bleeding. Now, what happens is breastfeeding causes your uterus to contract, so all of the stored stuff that's in there is gonna come out faster, okay? So we can make it stretch for 6 weeks, or we can get it done in 2. I know what my answer to that thought would be, but okay. Helps the uterus to return to the pre-pregnant size, which is how it helps the blood come out faster. Burns about 500 calories a day. Now that of course depends on how much your baby is eating. It increases your bond with your baby. The hormonal release increases your relaxation. It less time spent having to prepare and clean bottles. It's less expensive. It delays periods, which will assist but not prevent pregnancy. Lowers the risk of breast and ovarian cancer. Okay.
And with the hormonal release to increase relaxation, that also decreases your chance of getting postpartum depression.
Yes.
Because that's the feel-good hormone that's being released. So especially if you've had any type of mental health history in the past, it can be very beneficial when it comes to that.
Benefits to the baby. It's going to decrease your baby's risk of diarrhea, ear infections, lower respiratory infections. Decreases the risk of blood infections, bacterial meningitis, food poisonings. Decreases your risk of urinary tract infection, and decreases the risk of necrotizing enterocolitis, which is a fancy way of saying an intestinal infection. These are, our research is continuing, so we can't say these 100%, but it's going to decrease the baby's risk of SIDS, juvenile diabetes, Crohn's disease, ulcerative colitis, lymphoma, which is a type of cancer, allergies, and decreases the risk of other digestive issues, including acid reflux. Now, it's not part of this curriculum, so I can't present it, but we have other sources that are telling us that it's going to raise your baby's IQ by 5 points. And that's a good reason too as well. The benefits to society. It's going to lower the risk for child abuse and neglect. It's going to cause stronger mom and baby bonding. Helps kids get ready for school. Increases your baby spacing and reduce healthcare and WIC costs. And less work for the parent. So there's a couple reasons to breastfeed there. Hopefully this is something that you guys are interested in doing, and we're definitely going to be there with you and help you. It's not necessarily the easiest of things, but it's definitely worth it. Okay. So some of the positions for breastfeeding. This is going to be awkward to begin with, especially if you've never had a baby before. It's the reason that we brought out Lactisa, because we want everybody to try it at least once with one or two of the positions. So this is the cradle hold, and this is a mom just kind of cradling to her side and letting the baby feed. This is a hold that might be a little bit better for an older baby that has a little bit more head and neck control. The cross cradle hold. So we can see that's a little baby. And basically what the mom has done here is put the baby's body under her arm and has the baby across her belly at the opposite breast of her arm, and has that free hand to drink and eat and do whatever she needs to help the baby get latched. This is really hard and kind of awkward to begin with, but it's a really good hold. Maybe not if you've had a C-section, but it's a good hold. The next one is the clutch. We also call clutch football. And this is where we put the baby down beside us. We hold them the exact same way as cross cradle, except we have them down the side and we're using the same breast as hand. This is another good hold. I encourage moms to try this one for a number of reasons. Number one, it's easy to get a pillow under the baby so you're not holding the baby's weight. You have no pressure on your abdomen, especially if you've had a C-section. You can definitely and very easily see the baby's face, mouth, nose, really important to moms, and see your breast to get the baby on. Okay. The one thing that you want to remember with the clutch is that if a baby is not comfortable, they will not feed. So if you've got them all squunched up and there's no room for their feet, they're not going to feed. Okay. And then side lying. Side lying is where you lay down to breastfeed. This is a good hold. It does work. I don't necessarily encourage it, because what if you fall asleep? And we could definitely have a SIDS issue, and I actually recently had a client where her baby fell off the bed because she fell asleep. Baby's fine, but I wouldn't encourage that one unless you have somebody with you to make sure you don't go to sleep. So success with breastfeeding starts before your baby is born. Getting a little education, understanding how it works, understanding the anatomy and how milk comes out and how milk is made. When your baby's born, by making sure that you get good assistance with that beginning latch. We're going to watch a video, I think Monday or Wednesday, about breastfeeding and how to get it started with as little difficulty as possible. And of course, we're all always able to come up to the hospital, and I think everybody here has a care coordinator. So we would try to make it your care coordinator who comes up to the hospital to help you. During your baby's first 6 weeks, by making sure that your baby's latch is appropriate, because we want to make sure that you're not having any pain. We want to make sure the baby's latched appropriately and is able to take milk from you and gain weight. And then when you go back to work, and this is a really stressful time period for moms, because how do you feed the baby and go to work and pump and make sure that you're making all your hours and making sure your baby's happy and your husband's happy and all that. So I want to go back a little bit, and I want to see everybody try a hold or two. Okay? Now, who wants Lactisa?
You want it?
This one I don't
He
think
can
I'll be
try
able
too.
to.
I mean-
Yeah, see, you can try too.
Actually, the football hold is
Wait,
the
can we
hold
put-
that dads like the most.
Can we put the belly back on him?
And
Maybe
then-
try?
I'm not against